We'll go ahead and kick this off. Welcome to our first EMSC town hall in a hot minute. Really appreciate you guys joining us. I know everybody's really busy, but we've got some great stuff to cover today and get you all up to speed what's happening in the world of EMSC. All right, next slide, Amy. All right, so our general funding statement, basically we've got the MSC is funded EMSC Innovation Improvement Center along with data center funded at 2.5 and 3.2 million with certain costs going to these projects. So just reiterating that these contents are not those of the author. They may not reflect the policies of HHS, HRSA, or the US government. All right, so our agenda today, we are going to kick off some national updates from the EDC, the EIIC, PCARN, and then from HRSA. And we're going to allow some time for some Q&A to ask for any of the updates. So if you've got questions as our presenters are going through those national updates, if you could either just hold on to it or add it to the chat. We will provide time for Q&A at the end of that, just in one lump section, just to keep the flow of those national updates going. We then will move into some discussion questions that are really going to be focused on the PPR, or excuse me, the NPRP National Assessment, and Jane Osler from the EDC is going to help facilitate that. And then we'll go ahead and do a wrap up. Next slide. So we are doing a slightly different town hall format going forward. The EIIC and EDC will be hosting today's webinar as well as the May town hall, and future dates and details post-May to be forthcoming. Let's see. Oh, I'm sorry. I do want to note also, again, we want to thank you guys for joining. We know there's been a lot of uncertainty as it relates to funding and the continuity of the EMSC program. But we are excited that we can be with you here today. We will be sending out additional invites as as we get them scheduled. Amy, did the invite go out for May? Did the February and
Yes, I should have the invite for May as well. I
okay.
sent it
All right.
for this May.
All right. So at least we've got it on the calendar through May. And again, we'll get some details beyond July 1st, hopefully in the next month or so. All right. So on to national updates. Again, we will be taking questions at the end of our round of about 5 updates, but please feel free to go ahead and put them in the chat, or once we get to that Q&A, you can turn on your camera and ask them live as well. So I do believe we are going to start off with the EDC. Melissa, Jane, and Andrea will be providing the updates for the EDC today. So I'll go ahead and hand it to, I believe, Melissa will be kicking us off for this one.
Great. Can I share my slides, Rachel?
You should be able to. Let me know if you can.
Okay.
Okay, sorry, Jane will be starting.
Okay, no, that's okay. I am starting with Melissa. Melissa will start. I just wanted to, I'm driving.
Oh, great. Okay.
Thank you, Rachel, and thank you, Amy, for wrangling us all. As Jane just said, I'm going to kick us off just with a short introduction, since I am somewhat new to most of you, while Jane brings up those slides. So I'm really happy and excited to be able to be on the town hall today and to be able to introduce myself a little bit. So if you've been around EMSC, I'm sure you know Mike Ely, and we miss him terribly. He did retire at the end of December, and I am doing my due diligence to step into his shoes. It's not a feat that I even think I can tackle, but we're hitting it hard out of the gate. So I just wanted to say hello to everyone. I am Melissa Laws. I am an pediatric emergency department nurse by clinical training. I've actually been part of the EMSC program since about 2009, and about 100 years ago was EMT basic trained. So I feel like my career has been living and breathing the EMSC program for many, many years now. I have worked closely with Mike over the last couple of years, but the majority of my EMSC experience has been with the PCAR network. I'm just really excited to start working with our group here at the EDC. I've been doing that for a couple of years now, more closely in the last few months and at the end of last year. The PEDS Ready initiatives do come close to my heart, and all of the EMSC work that we do, everything that we do really leads into that. So I'm happy to pass it over to Jane and Andrea today to give us our NPRP and PPRP updates. But if anyone needs anything, has any questions, please feel free to reach out to me just in the way that you did with Mike in the past. And we are excited as a team to continue this work.
Thanks, Melissa. We truly appreciate all of the efforts from our EMSC State Partnership Program Managers to update your emergency department contacts in the contactless management system. This is just a reminder that you can update records now and throughout the data collection period as you get new information. Just be sure to please include 24/7 freestanding EDs. We've seen a rise in the number of freestanding EDs that are coming about, so please include them if they're 24/7. Also include Indian Health Service, tribal, and military sites as important segments of our population, our target population. We do have several national organizations who are eager to support you: ENA, ACEP, AAP, ACSCOT, especially at the state level. So please reach out to your state chapters, especially ENA. They might be able to help you with contacts, but if you need more information on that, you're welcome to reach out to your EDC TA. So just a couple of NPRP focused tech talks are coming up in February and March that you will not want to miss. We've created several dashboards to help you monitor your state's ED's response to the National Pediatric Readiness Project assessment during the data collection period. This will be incredibly helpful to show you where to apply your data collection efforts, update CLEMS in real time, and a whole lot more. We're also going to show you how to effectively use phone calling tools and resources to help you boost your response rates. So also just a quick reminder that EDC phone calling support is available through the request form, whether or not you're EDC or state-led. You can request support as resources are available through the EDC. Braden's going to put that in the chat for you. So if you're thinking ahead and you'd like our assistance, please feel free to fill out that form. The open assessment, as expected, will close just before launch so that we can all shift our focus to the newly released guidelines and the upcoming assessment launching on March 3rd. You should have received a couple of communications about printing any PDF gap reports from the 2021 national period through the current open assessment period. And to do that, you need to do it before February 18th. We're happy to help you to kind of navigate to the gap report reprint dashboards for that if you need some support there. And we're aware that there's been requests for past versions of gap reports and are currently looking into ways to accommodate those needs. But for now, we encourage you to print the older versions in Tableau if you'd like to. Also, just a reminder that on February 24th, all managers need to send out the pre-notice to your emergency department. So whether you're EDC-led, whether you're state-led, this communication comes from you to let your EDs know that invitations will be coming to take the assessment on March 3rd. It's a great point of contact. It allows you to see whether or not you have any bounce backs that can be quickly corrected before that launch email goes out. So your EDC TA is also very eager to support you, and we'll be reaching out this week just to see if you have any questions about the assessment, the data collection process, any of the templates that we've been sending out, whatever you want to discuss, we're here for you. So we'll be reaching out to see if you want to meet. So I'm going to turn it over to Andrea.
Hello, and thanks, Jane. So Jane talked about the open assessment period for the NPRP, which is with the hospitals. Lots of alphabets out here. But we've also had lots of questions about the open assessment for the PPRP, which is with EMS and fire rescue. And the great news is that it will open this year. We don't have an exact date yet. We're still working on the strategy for that, and we'll let you know as soon as it will, but it will open this year. Also, speaking of which, of the PPRP, a little bit later, Kathleen will be talking about the publication, but that is very close. And when that happens, the national summary reports will be available at that time. We'll communicate all of that and the timelines to you later, just to let you know that it will be coming, so you can all rejoice in that. Next slide, please. So we also want to let you know that we have lots of new things on our website, specifically for managers. And you can see here we now have a section. This is in response to managers asking for us to have links like to Clems and Tableau on our website to maintain security. We now have that as a secure login space where managers can go. And there's other resources we have in that section that are just very specific to managers. To all managers, so they can go there and get those resources and use the same login as you do for Clems and Tableau. Next slide, please. And then the final is finally we're able to get our resource catalog section built out on our website, and all those great resources we had on our website in the past will be available for download from our new website as IT is building this out, and this should be up and running this year as well in the next couple of months. That's everything that I wanted to update people on regarding the PPRP and the EDC. Back to you, Jane.
Thanks, Andrea. And we just truly want to share our sincerest appreciation to all of our national colleagues, to HRSA, the EIIC, and especially our EMSC State Partnership Program Managers for your incredible support on behalf of pediatric readiness research. Your time, your efforts, your passion are making a difference in saving lives. We for sure could not do any of this without you. Love bragging about you and just can't thank you enough. So hope you're doing well and look forward to serving with you in all these projects.
Thank you so much, you guys. Really appreciate that. I do see there's a couple questions in the chat. I just want to acknowledge that we do see them, and we'll get to those at the end of these updates. And so next we're going to move on to the EIIC. Doctors Kathleen Adelgase and Kate Remick will provide a few minutes of updates for the EMSC Innovation and Improvement Center.
Sorry about that, trying to come off mute. Hi, everyone. Thank you so much. I wanted to let people know that we are anticipating a publication in Annals of Emergency Medicine soon. The national median score for the Prehospital Pediatric Readiness Project annual or assessment that was done is actually 66, 65.5 if you want to be exact. Overall, about 72% of our respondents were ALS agencies, but we were quite excited about this score. The biggest thing we found was that the presence of a PEC, not surprisingly, is the strongest driver of higher scores. If we looked by specific domains, the likelihood of having a domain score that was the highest score possible was significantly associated with the presence of a PEC in the agency. I will also say that from 2017 to now, almost 10 years later, we have seen an overall increase in the number of agencies reporting that they have a PEC, where I think we started kind of nationally, it was around 23%, and now we are up to 38%, but still less than half of agencies have one. The big strength was that about 83% of agencies have all the recommended pediatric equipment. That is something that the EMSC program has really been working hard on for quite some time. So we're really excited to see that. Next slide. So next up, we will be presenting on the full data findings on February 26th. Dr. Mini Shah and myself will be giving this presentation. We're really excited to be able to partner with NAEMT on this. And in this presentation, our goal, for anyone participating is to hear fully about the entire thing from start to finish of what the PPRP is and how it started out, how we developed the assessment, what the findings are, and what are next steps to really support EMS agencies in their pediatric readiness work. The other thing that we are doing right now is working on a set of learning modules for PECs. And so we'll kind of continue to be able to get those out and up on the EIIC website once complete. And then finally, the joint policy statement that was initially published in 2020 is undergoing revisions and will probably not come out until 2027. These joint policy statements take a lot of work on the different national organizations and a comprehensive review of new evidence to kind of put recommendations into place. So continue to distribute and put out the current policy statement published in 2020, but know that there is some work underway to kind of do that. And Dr. Sylvia Wusuansa is taking the lead on that and kind of organizing the team. It will still be a joint policy statement with AAP, in addition to National Association of EMTs, National Association of EMS Physicians, ENA, and American College of Emergency Physicians. However, we're grateful to have NASEMSO also as a partner on the writing team, given their really important role in supporting overall EMS work, and particularly pediatric readiness work across the country. And then, our big goal is to really initiate research to study the impact of overall readiness in EMS agencies on patient outcomes that, is a key validation of what does a pediatric readiness score mean in out-of-hospital care for children. We have that information specifically in hospitals, but we don't have that information in EMS. Our work involves a pretty robust research group that is kind of leading this. If anyone wants to participate in that, please just reach out to Dr. Shah or myself to get involved. We want the data to be used. We want the data to study local and national initiatives in pre-hospital care. So thank you so much.
Thanks, Kathleen. Good afternoon, everyone. Great to see you. As many of you know, the Joint Policy Statement for PEDS Ready and Emergency Departments is officially out. It was published on January 20th in all of the partnering organization journals. So American Academy of Pediatrics, American College of Emergency Physicians, the Emergency Nurses Association, and the American College of Surgeons Committee on Trauma, which is a new co-author on the joint policy statement this round, which is really, really exciting. We are hosting a webinar tomorrow at 1 p.m. Central Time. I saw in the chat that some of you are unable to join. There will be a recording, so don't worry if you can't join. We have had a lot of great interest, and we do encourage you to register, even if you're not able to join, so that we can make sure we know who is interested and make sure that the recording gets out to everyone who registered. If you haven't seen the registration link, the QR code is here. We have had already over 1,200 individuals register, which is fantastic. During this particular webinar, we'll be talking about what's new in the joint policy statement. We'll also be talking a little bit about the assessment and what people can expect when they go to log in to take the assessment. So it's really a dual effort to address both of those. So much of our focus is gearing up towards the assessment. And if you go to the next slide, please. We really, the communications team has done a tremendous job of creating a fantastic set of promotional materials that are available to all of you to use. If you navigate to the EIIC website and under the Pediatric Readiness and Emergency Departments specific page, you'll find a button that says Spread the Word, where you can find all of these materials. Just briefly, what each of these are. So the talking points is really available, gives you just kind of basic talking points around why pediatric readiness is important, a little bit about the assessment, dates, etc. There's a news or web blurb that you can push out with any newsletters you might have. We also have these template emails that can be used to help inform leadership. A stock deck that is just coming very soon, recently posted, but will be available that all of you can use if you're giving presentations related to PEDS readiness, the NPRP assessment. And then a couple of these flyers. So one on the assessment overall, one focused on the differences between the prior pediatric readiness guidelines and what's new in 2026. Just to highlight a few of those, and I know some of you have seen these emails, a few of the new additions in 2026, which we'll also be discussing tomorrow during the webinar, is having a color-coded weight-based pediatric resuscitation cart that's immediately available and portable, so easily accessible for clinicians. Also included are more specific recommendations around suicidality, agitation management, and then having some clinical protocols that are really focused on common clinical conditions. I know some of you have gotten some questions about that and concerns, and you'll see kind of how that is written into the assessment. But please know, not every single item is expected when individuals going to take the assessment. But you'll see those items highlighted in this flyer. There's also this mortality impact flyer, which just kind of highlights the importance of pediatric readiness. The roadmap really helps people who are serving in the role as a PEDS emergency care coordinator or a champion. Where do I start? How do I do this work? Really just kind of is intended to help guide people on the stepwise approach to improving pediatric readiness. And then lastly, if you're pushing out materials to your community within your states, there are signature options and or email banners that are here that you can use. And that just kind of helps to raise awareness around pediatric readiness, and really encourage you guys to think about using that in addition to placing banners perhaps on your website. And then lastly, of course, you'll see some social media graphics that you can push out or share, all of which are located here. There's a bunch of social media graphics. Choose whichever ones you like best, but they're there and available for you. And we hope this makes your lives easier. So I think that's all I have. And I'll turn it back to you. Thanks, Rachel.
Thanks, Kate. I'm also going to take advantage of the fact that I'm the MC, and I really want to plug really quickly the State Partnership Program Manager dashboard. Andrew, Amy, if you could dump that link in the chat. Please just remember that it's there. We are getting that updated pretty frequently to include little blurbs about state updates and really great things that you're doing within your states that we want everybody to know about and share and spread the good word. So with that, I am going to hand this over to Dr. Lynn Babcock with PCARN for an update from that group.
Hi, everyone. I'm Lynn Babcock. I'm at Cincinnati, but I've been the chair of PCARN for the past year and have been involved in the network since 2001. So I have a lot of historical knowledge. So if you want to know something that happened 25 years ago, I can probably tell you. So it is our 25th anniversary. So I do want to say thank you so much for all the support we've had. We continue to do great work, and I am very blessed to be part of this network and part of HRSA and EMSC. Next slide. So I just wanted to give you an idea. So besides, what we are really for is to generate the best actionable evidence to make sure that every child gets the optimal care regardless of where they're seen. across the EMSC continuum. So that's either from the community all the way through to EMS, to a local hospital, and to our tertiary and quaternary care centers. Although it seems like we're generating most of the evidence in quaternary care centers, we have a mission to make sure that this evidence is generalizable to the entire population of children that we care for. So I just wanted to give you some glimpses of what we do. Some of the recent best evidence generated to help care for acutely ill and injured children. So we have answered these questions: which injured children will actually need a C-collar placed by EMS, and what children need to be imaged in the ED. So these have been recent publications that have been out and disseminated in multiple channels to get this information into the hands of providers. We have sepsis learning, can machine learning help to identify children at risk of sepsis, and do probiotics improve outcomes for children with acute gastroenteritis? And the answer to that is no. So, but those are all, and that was published in New England Journal of Medicine. So these are really broad reaching evidence that we're trying to generate. Next slide. If you haven't heard, or you're not a PIT fan, but PIT does talk about emergency care. And so one of the questions that we did answer recently in our febrile infant decision rules is which well-appearing febrile infant truly needed a lumbar puncture. If you're a PIT fan, go ahead and scroll to season 2, episode 1, and you will see the name PCARN come up when they're talking about a febrile infant, about how to work up the patient and what tests to do. So we felt like as if we've made it big time when we've actually hit national TV. And so this was a little bit of a win that evidence is getting into the hands of providers and even Hollywood. Next slide. Next slide, sorry. Great. This is just going to give you some both things that are just that are ongoing right now in our network, some of the studies that are ongoing. So these are questions that we're answering right now. What is the best way for EMS to give seizure medications to kids? So in the field, what fluids protect the kids' kidneys during bad E. coli infection, which is, some of you might have heard of something called HUS. What helps kids with sickle cell disease feel better during painful episodes? Does universal HIV screening in the ED help connect teens to needed care? Does bedside ultrasound help care for kids with abdominal injuries? And what factors help identify which children with pneumonia can get very sick? Next slide. And we're just starting all these projects. So those past ones that are ongoing, some you'll start to see some evidence come out, and I'll be happy to share those when we do get them and provide that to everyone. But these are just starting projects that we're pretty excited about. What's the best airway approach for sick children in the EMS setting, whether it's bag mask, supraglottic, or intubation? So that trial has started. Which pain medication is safer and works better for severe pain in kids? Is it morphine or ketamine? So that's very exciting as well. Can ketamine stop seizures that don't respond to benzodiazepines? Can BiPAP help kids with severe asthma breathe easier? And that's obviously an emergency department study. And can we spot injury trends earlier using the electronic health data? And can telehealth with pediatric experts help EMS care for critically ill children? So as you can see, the evidence that we're trying to generate is broad reaching and across the entire EMSC curriculum. If anybody wants any additional information, please feel free to reach out to me, and I'm happy to help direct you or give you the answers.
Awesome. Thank you so much. I love seeing more and more of that pre-hospital research ongoing with PCAR. So thanks so much for that update. All right, next, Emily Lemiska is going to provide an update on behalf of HRSA EMSC.
Hello, everyone. Nice to be here with you after a bit of a hiatus. Emily Lemiska, Director of Communications for EMSC, and here to share some updates on behalf of HRSA/EMSC. Next slide, please. So first and foremost, we are very happy to share news of the spending bill passing for the HRSA Maternal Child Health and Bureau programs. specifically the EMSC program, which is funded at 24 million, and the Special Projects of Regional and National Significance Regional Pediatric Pandemic Network at 25 million. Very great news and glad to hear that. We also wanted to introduce for awareness two new MCHB staff members who are taking on roles previously held by Dr. Michael Warren and Lauren Kavana, two names you might recognize. Those two new staff members are Eliza Hepner, who will be MCHB's acting associate administrator, providing leadership and oversight for the Bureau and its programs. She has extensive HRSA leadership experience across MCHB, the Bureau of Health Workforce, and the immediate office of the administrator. She has led cross-bureau initiatives to advance agency priorities and to improve access to high-quality care in underserved communities. Her prior experience includes working with the AARP. There's also Lauren Ramos, who will be acting Deputy Associate Administrator. She has 13 years of experience in government and public health and has led national maternal and child health workforce development efforts and key MCHB initiatives, including autism and one that we're all very familiar with, the Pediatric Mental Health Care Access Program. She has had a focus on improving access to care for children and youth through strengthening workforce and systems. She's a former leader at AMCHIP, or the Association of Maternal and Child Health Programs, as well as the Association of State and Territorial Health Officials. So welcome to both of those new staff members. And then finally, while you probably have heard this news, and these staff members have been retired for a couple of months, we haven't yet had a chance to recognize them in person at a town hall and wanted to do so. So first, of course, we wanted to recognize the contributions of Jocelyn Hulbert. She retired earlier this fall after 38 years with EMSC. The EMSC branch is so grateful for Jocelyn's steady leadership and dedication to advancing its mission at HRSA and at Children's National. She provided leadership during transitions, ensuring continuity and stability across teams and programs. For all that interacted with her, she offered insightful guidance and support and was committed to collaboration, quality improvement, and system-level impact. Joss was also a skilled mentor and coach who was always supporting staff and state manager growth and cultivating future leaders. We also wanted to make sure folks were aware of the retirement of Diane Pilkey as of December 2025. We are so grateful for Diane's oversight of numerous national and state EMSC initiatives, including her work on program strategy, partnerships, and performance improvement. Diane was dedicated to growing the field of knowledge in this space through authorship roles in numerous publications and a collaborative approach to federal public health and child health research partnerships. Some of the research projects she contributed to include fetal, infant, and child death review, a public health approach to reducing mortality and morbidity, research, practice, and data-informed investigations of child and youth suicide, and comparing prevalence estimate of concussion/head injury in U.S. children and adolescents. So just wanted to give a shout out to both of these now former EMSC team members. They will be deeply missed, and we are so grateful for their contributions. But that's all I had from HRSA MCHB. So back to you, Rachel.
Awesome. Thank you, Emily. Got a little sad seeing Joss's face there. I do miss her terribly. I'm assuming she's having a wonderful time being a grandmother. All right, so to the Q&A, I'm going to kind of jump to the top here. Rachel Ford asked a question for EDC about the pre-notice being optional, and Jane clarified that the pre-notice is one that everybody sends out, but the supplemental reminder is the optional one. Rachel, if you want to jump off mute or add another comment, I'm assuming that answered your question. Corolla asked if there's a thumbs up, thanks. Corolla asked if there's a projected timeline for another PPRP assessment. Corolla, in the performance measure manual, it does indicate the projected timeline for both NPRP and PPRP assessments are every 5 years. So nothing solid right now, but that's kind of where we're projecting the next full PPRP assessment. So if I'm doing my math right, that would be 2030. Kyle asked about the stock deck, and yes, as Emily mentioned, we should have something within the next week or so, but Magic, Emily, and Andy can help get you something quicker if needed. Let's see. And yes, tomorrow's NPRP webinar will be recorded. We will be sharing that. Emily, I'm assuming we'll probably be posting that on our webinar page on the EIIC website, and we'll send a communication out to all of you managers as well. Sam, thank you so much for the shout out to the roadmap. I think that's pretty cool too. We are working on one for PPRP as well, so you guys can share with your pre-hospital PECs as well. Nick asking about, journal article for the C-color, and Robin posted it. Kate, do you want to clarify anything more about the comment from Emily about the cart in the ED?
Yeah, I added, thanks for that, Rachel. I added a comment into the chat about it, but most emergency departments, and this is true even if children's hospitals, only have one or two rooms that are really dedicated for resuscitation, where they have the full complement of equipment. And usually, even then, it's set up in some kind of mobile resuscitation cart. Many smaller EDs may not have any rooms that are really set up with full complement of pediatric specific resuscitation equipment. It's just, by virtue of design and use cases and stuff. And so most have relied on either resuscitation bags or carts of some sort. And the idea is that they be mobile so that if you have a child in extremis, that you can get that equipment to them as quickly as possible. The term cart could be interpreted, individually. I mean, you could potentially have a weight-based color-coded bag that's on some kind of mobile cart that can be moved around to different rooms, things like that. But the idea is that it be mobile and it be weight-based and color-coded so that it's easy to find what you need in a true emergency. So hopefully that answers that question. Thanks.
Great. Thank you, Kate. Oh geez, Ford, I think year math is almost as hard for me as time zone math. So yeah, I think you're I think you're right. I think the next PPR assessment is 29, not 30. And then passing of grant funding for 26, 27. Are you asking, I'm assuming you're meaning for state partnership grant cycle starting April 1. The funding bill that was passed is inclusive of state partnership grants, but I don't think any of us here can answer what I think you're really looking for is like when your NOAs will be coming out. I'm sorry, I can't dive into that because I don't have insight into that necessarily. I don't know if there's anybody else on here who might be able to talk to that.
Rachel, can you hear me?
Yes.
So this is T from HRSA.
Hi, T.
Just a quick update on the state partnership grant awards. We are currently in the process immediately after returning from the furlough of processing and completing the NCC reviews and processing the notice of awards. So the team completed those awards. It's now going through the channels for additional review and approvals, and we are hopeful that they'll be released before April 1st. We normally try to get them out 30 days before the start of the next state partnership fiscal year. We're doing our best to help make that happen.
Fantastic. Thank you, T. It's good to hear your voice.
Thank you so much.
Okay, so and yeah, Emily's clarifying that we've got a few other webinars aside from the February 12th one tomorrow for NPRP. We also have one upcoming PPRP, which Dr. Algase mentioned, and apologize for the bad scheduling of that webinar. I do know it is layered on top of the EDC's Tech Talk. I do want to encourage you all to attend the Tech Talk. The PPRP webinar is really geared more towards EMS agencies and what they can do to help improve their pediatric readiness. That will also be recorded and shared with you. So it's probably more important to attend that Tech Talk and interact with the EDC But we will still share that NAEMT webinar with you all. Emily's asking more about the cart. Is there something I still need to address here? I can't follow all
I
of this
think
cart
there's
discussion.
there are concerns that in some hospitals it sounds like they have one or two rooms that are fully stocked with the pediatric equipment, is what they're saying, and so they don't use mobile carts to move it around. I think, the idea is that there's the full complement of pediatric resuscitation equipment. It's immediately available, it's color coded, it's weight based. And that's really the goal, is to make sure that when the equipment is needed, it can be readily accessed and easily organized to find the right size.
Okay. I see. T, I don't know if you can talk to full or partial funding for the NOA. Is it going to be like last year, receiving partial funding due to the government not being funded past October 1? I don't know if you can talk to that. Throw up smoke signals. Okay. I'm not sure we can answer that question, guys. I'm so sorry. For Mark, what happens with state programs? EDC, can you talk to this? Is this something where managers could then ask EDC to handle communications, or any thoughts on Mark's question?
For the NPRP assessment,
Yes.
that what we're talking about? Yes. So we have been talking in the background of how to transition that from state-led to EDC-led, if I understand his question correctly. So we are putting pieces in place for that.
Okay, awesome. Thank you. And for I'm sorry, I'll go back to this full partial funding. We'll see if we can get a response from HRSA to share with all of you guys additional information.
Rachel,
Oh, yes.
I'm sorry,
Yeah.
I didn't, I'm sorry, I didn't hear the question because I lost connection. Can you
that's
repeat
okay.
the question? I'll try to answer it.
Yeah, people are wondering if you can talk to whether or not the NOAs that will hopefully be coming in out before the end of March will be for partial or full state partnership funding. Can you speak to that?
So in years past, the reason why the NOAs were partial funding was we were in a period of continuing resolution. And under that situation and that status, the HHS and HRSA only receive a proportion of its full year budget. For FY 2026, when we returned from furlough and the government reopened, we had received, HHS and HRSA had received a full appropriation. And that equates to the state partnership awards being able to receive full funding for their awards as well.
Amazing. Thank you, T. I'm glad you're able to speak to that. Appreciate it.
Yes, thank you.
Melissa, I'm assuming that yes, the EDC will communicate their plan to transfer once known.
Yes, and I think that goes, I'm glad that T spoke up, because I think in general, if there is a concern about programs, and I think the funding question is getting answered, we still obviously want everyone to try to attempt the assessments and complete those. If there's specific state-led communication versus EDC-led communication, we can certainly jump in and take over if the managers are not able to do that. And so just reach out to your TA, or we'll be reaching out to you, and we can confirm those processes. But regardless, we still want everybody to try to be completing the assessments. We'll just figure out the best way to help everyone do that.
Fantastic. Thank you. Angie, Amy, did I miss anything in the chat?
I think you covered everything.
Okay. Awesome. Anybody want to go off mute, or any other last questions for any of the centers before we move on to the more directed discussion related to the assessment, which we've already kind of been kind of addressing, but All right. Okay, I am going to hand this over to Jane um, to lead discussion about the assessment. Um, but if you guys think of something else unrelated, please don't hesitate to drop it in the chat, and we can swing back to that if necessary.
Thanks, Rachel. Already had a lot of great discussion, like you said in the chat, which is awesome. So I hope you keep your questions coming. If you could advance to the next slide there, that would be great. So first question here that I'm throwing out to the group is, what do you want to know about the assessment that you don't know yet? I know that there are several managers here that are very well versed in our data collection periods. We have so much fun during the data collection periods together. So if this is your first go around, or maybe you've only experienced what happens during PPRP, you might have a little bit of experience, but what lingering questions or things do you want to know about the assessment that you don't know about? You're welcome to take yourself off mute or ask questions in the chat. Rachel, I guess you're still moderating the chat there.
Yes, so far, nothing new.
Okay.
Except that we're all celebrating that Kansas has a new EMSC coordinator.
Yes, that's so exciting. That is so exciting. Very excited for that. So I know that we've sent out quite a bit of information from the EDC. We've had the joint policy statement that's come out in January, and a lot of information coming at you hard and fast about the MPRP assessment. I'll just talk about a couple of things while you're thinking of questions that you might have. As Rachel mentioned, the pre-notice is one of the many invitations and reminders that get sent out to emergency departments. And managers, whether you're EDC or you're state-led, that pre-notice does come from you because you know your state's best, you know your emergency department's best, and them seeing this coming from you is like, oh, this is something going on in our state. We're really gearing up for it. They're gearing up for it, and it encourages participation. But it's also just such a great way to see whether or not you get any bounce backs from communications. This is incredibly important because if they don't receive communication right at the onset, and that doesn't get updated, then they never receive communication. So we want to make sure that those contacts are very well updated, as you all do such a great job with that. I see that Rachel does have a question too. What substantive differences in PEDS readiness requirements between 2021 and 2026 assessments? That's a really great question. We know that with every time we have an assessment, we learn things. And when we have new guidelines, those new guidelines help to inform a new assessment. Now, most of what you're going to see on the 2026 assessment is going to be very similar to 2021 with some updates, some changes. A lot of what we've done is to help clarify some questions. We've clarified quite a few things with examples inside the questions so that they're clear. We know that the frequently asked questions page will be up on the website as well for those that have additional questions for that. They can always contact PEDS Ready Support. But some new things that just in brief are just the availability of physicians 24/7, either in person or on call, the use of a validated triage tool, suicide screening and assessment, acute agitation protocol, clinical pediatric protocols for common conditions like seizure and asthma. There's new equipment recommendations, and like I said, there's updates to existing questions. So these things will be covered likely in the February 12th webinar, but they're also clarified in brief on the flyers and the Spread the Word page. So you're welcome to check that out there as well. But you'll also see on the assessment comparison in your gap report, or in the emergency department's gap report, they'll see comparison from 2026 to the last time they took the assessment. So that's either the open assessment, if that was the last time they took it, or to 2021, if that's the last time that they took it. So I hope that answers your question. Looks like Emily has another question. Can you review the inclusion criteria again? If military/veteran hospital EDs report they are not allowed to complete the assessment, should we still include them in CLEMS? So that's a great question, Emily. So the inclusion criteria is all 24/7 EDs and military, like military and IHS and tribal are included in CLEMS as a performance measure option. So you'll see in CLEMS, most of them say none of the above, meaning that they're part of the performance measure calculation. It's not required that you include military or VA, but we have had quite a bit of military sites reach out to us and say, hey, we want to be included. We need to take the assessment for ACS center verification. So if they're not allowed to complete the assessment, they don't have to, but you can include them in CLEMS for sure. Let me know if that doesn't answer that question.
Does, thank you.
So Wendy just had a new ED open. They'd like to participate. Is it too late to add them into CLEMS? Absolutely, you can totally add them to CLEMS. You can do it, right this minute if you'd like to. CLEMS is open to update your records, to add new emergency departments, and you'll see throughout the data collection period with our monitoring dashboards that come out that we will be showing you maybe some differences that we see from respondents versus what you have in CLEMS. And you can make those updates in real time throughout the data collection period. So we're excited to hear from Patty at Tech Talks in a couple weeks. Andre confirms that, yes, please add them, remove hospitals if you need to. And yes, it does dynamically update. So thanks for sharing the link to that flyer, Emily. Right. Keep the questions coming as you get them. If you have any assessment questions, you're welcome to put those in the chat still. But I'm going to move on to the next question. It says, what do you think are the biggest challenges with getting engagement in the assessment? So what are some things that you're coming up against, either from ED clinicians, from contacts that you have, or in your meetings with your advisory committees or with other organizations that you're trying to promote to? What are some of the biggest challenges that you're facing with engagement? Good one. That's Sam in Michigan. We just submitted a PEDS Ready assessment. Why do we need to do this again now? That's such a great question. You'll probably hear this a lot from your EDs. So all of us know that, when we have a national data collection period, shortly thereafter, we try to open up what's called an open assessment period. The national assessment period captures the nation at a very specific point in time, and we need that inclusion of as many EDs as possible so that we get a representative sample. In addition to the fact that these are new, some of these questions are new on this assessment, and the assessment is based on the most current evidence. And we want people to always be up to date with the most current evidence, be marking and benchmarking against the current guidelines. And so it is really important for them, as well as for us, to have them, update everything to the new guidelines. I know that there are some states that require folks taking the assessment once a year. And certainly if they just barely took the open assessment, you can thank them profusely and say, thank you so much for participating. You're that much more ready to participate in 2026. Please join us. We're really excited to have you include your ED as part of the national results. And they can feel confident and comfortable that they're still working towards pediatric readiness improvement against the nation. They also might be interested in knowing that on the GAP report during the 2026 data collection period, they will also see comparisons that are dynamic throughout the data collection period to hospitals of similar volume across the nation. So they might just be interested in those results too. So if they have any questions or concerns beyond that, you're welcome to send them over to PEDS Ready Support, and we're happy to answer any questions they might have. So Yes, so many people are saying that. If a hospital makes a mistake on their NPRP assessment, can it be reopened after it's been submitted to make corrections? So the answer to that question, unfortunately, Greg, is no. It is the standard for research that if you once you've submitted something, we don't go back and we don't change the answer. Certainly, this is challenging because during the open assessment period, people can take the assessment multiple times, but during the national data collection period, people can only take the assessment once. So there are a few very rare exceptions to when we would reset an assessment. First and foremost, that's if a hospital went into our portal, accidentally selected the wrong hospital, took it for the wrong hospital. That is one instance where we would reset it. The other instance is if the ED said that they did not operate 24/7 when they actually do. That would be a time when we could reopen it. But for all other, if they, made a mistake or they want to go back in, unfortunately, they can't go back in to do that. So,
Jane,
uh-huh.
this is Andrea. Before you go on, do you also want to explain like the new wording we added about to make sure it's the appropriate person completing the assessment?
Mm-hmm. Yes, absolutely. I think that is a key thing to communicate that we've been trying to communicate in all of our flyers and all of our presentations, all of our webinars. We used to send invitations and reminders out via postal mail. If you all remember that, sending letters and postcards out to emergency departments to take the assessment. This is the first go around where we've done it through Constant Contact, our email marketing service for our EDC-led states and via email from our state-led states. And so though we're targeting specific contacts through who we have listed in CLEMS, we do want it to be a collaborative effort at the ED. We know that lots of different people take the assessment, especially from the open assessment period. We see lots of trauma center coordinators, PECs, ED nurse managers, physician managers, lots of different people that are interested in taking the assessment. And so in order to kind of, subvert whether or not, we have the right person taking it, we just really want folks to collaborate with each other to take it. And you'll see that in the templates that we've created. Information about collaboration, you can only take it once, that kind of thing. So hopefully that helps to target a team effort there. Thanks for that, Andrea. Let's see. Sorry, I'm having a hard time following along. Rachel, can you tell me which question is next here?
Yeah, I think, let's see, somebody's asking, Vicky's asking about, people are wondering if their score is going to go down because the questions are different. I don't think we got to that one yet.
Yeah, that's a good question. I'm going to pass that one over to Kate to talk about.
And Kate,
if that's okay.
Yeah, thanks. And if Kate, you could also address the ACS part of it too, the concerns that they might be punished or not verified if the score goes down.
Yeah, so ACS is not using a score for part of their verification criteria. What they are using is just that every ACS verified trauma center is expected to take the assessment and address or develop a plan to address any and all deficiencies. So regardless of the score, it's really about identifying opportunities for improvement and developing a plan to address them. In terms of the overall score, each of the domains is scored exactly the same. We shouldn't see really any significant differences in scoring. Any variation in scoring should be minor. It would take too long to go into every single detail about that, but generally speaking, we don't expect to see any significant or wide variation in the overall scores from previous assessments. Hopefully that addresses the question. If not, I'm happy to add more detail.
And then also, Kate, you're going to be talking to those changes in the webinar tomorrow, correct?
Well, we're not getting the details of the scoring are probably a little bit more than what we can realistically cover in that webinar. So if there are
Well, sorry, not the details of scoring, but like the differences between
Yes,
the changes.
yes,
Yeah.
absolutely. Yeah, we will talk about all the specific changes or modifications from 2026.
Yeah. Okay.
Prior based on the prior 2018. Yeah.
Okay.
Yeah.
Mike just notes that personnel turnover and competing priorities like staffing, throughput, and system priorities. He's working with statewide organizations to join the bandwagon to support the need to conduct the survey for hospital associations and ENA, etc.
Yeah, that's very relatable, Michael. That is a huge challenge and a big lift on your part and the part of, your EMSC advisory committee and those that work with you on behalf of this effort to keep awareness at the forefront. Can't thank you enough for your efforts there because it is a big challenge for sure.
Yeah, absolutely. Sam is thanking Kate for her response. It's going to put a lot of locations at ease. She's been trying to ensure that it's not about the score. It's not just about the score, but helps to have it from other people and organizations to reiterate that as well. Emily notes that we've been pushing EDs to aim for 88 plus. Is that that's what's tied to improved outcomes with the new assessment? Can I still say that? And should we use it as a ready level while we wait for new research to be conducted? Great question, Emily.
I can try to address that, Rachel. So a lot of the data on the 88 plus mark and being associated with decreased mortality risk actually came from the 2013 assessment results. And some of the more recent publications using the 2021 assessment results actually suggested the cutoff may be closer to 93. And we don't know what that's going to look like with 2026. So I think the point of all of this is don't hang your hat necessarily on the score, as we already talked about, and really focusing on where are the opportunities for improvement, which is what, the approach that ACS has taken in their verification. But generally speaking, we have said 88 and above is what we're trying to aim for across the board. So hopefully that's helpful.
Okay, great. I think Corolla's cat might have just walked across her keyboard. Greg is asking about the EDC's guidance when a hospital system, one person wants to complete the assessment for multiple hospitals. Oh my gosh, 8, 12 or more. Any
Yeah,
guidance on that?
that's a great question. And we get that question actually more than you'd think, Greg. It's really interesting. I have HR reps, I have insurance companies asking me if they can take the assessment for their hospital systems. And our response is typically, thank you so much for your interest. Like we really, really appreciate the efforts that you're taking to ensure pediatric readiness at your emergency departments throughout your system. The assessment needs to be taken by someone who works on site at the emergency department, who is familiar with the day-to-day operations of the emergency department. The questions from the assessment need to be answered by someone who actually works in the environment, because they cover a wide variety of things from equipment to policies to pediatric emergency care coordination, quality improvement, performance improvement plans. And so they are welcome to collaborate with their emergency departments on behalf of the assessment, but the person that actually needs to take it needs to be someone who's a little more boots on the ground. They will determine that in amongst their ED leadership, again, because you can only take it once. The second thing I would say to that is that there may be technical difficulties that are associated with someone trying to enter multiple assessments that we will not be able to undo if either a mistake is made or their cache doesn't correctly connect with the right assessment because they're entering in multiple ones. So it is a very precarious thing to enter in multiple assessments that could be detrimental to their overall scoring. If something gets entered in wrong, if something, one goes in after the other, but they step away from the assessment and try to come back, those types of things. There's just a lot of back end issues that can occur with that. So we do not recommend entering in multiple assessments for emergency departments for that reason. The third thing I would say to that is that it's also a way to engage your emergency department with your health system in pediatric readiness efforts. Remind them that there are resources available to help them improve, that they don't need to reinvent the wheel. We have so many resources available from the EIIC to keep pediatric readiness updates and guidelines and everything consistent across the nation, and that we're here to help and support them in their efforts every step of the way. So I hope that's useful.
Yeah, thanks for that, Jane. I'm wondering with some of these questions, and maybe this was addressed already, I missed it. Is there maybe an FAQ or something that's been put together or can be added to that addresses some of these questions that managers have been hearing from hospitals?
Yeah, go ahead, Emily.
Yeah, I was just going to say, I was just putting that link into the chat and wanting folks to know that sharing this feedback you get from EDs is super helpful to us because we can refine the FAQs and make sure that you have messaging in your toolbox to give to EDs who have these concerns or questions. So really appreciate hearing from all of you. The link I shared is just kind of like our base set of FAQs that we've developed in concert with the EDC, but we'll be updating it on a rolling basis. So feel free to keep sharing what you're hearing from your EDs.
Awesome.
Yeah, we appreciate that, Emily. We're also on the back end, also compiling questions that you have to try to address them largely from EDC TA standpoint as well, knowing that you have unique challenges in your state. So please keep those questions coming. We really appreciate it and hope to address that largely as we go along.
Yeah, great. And just noting that Bobbin related to the ACS question just copied the standard, which is 510 pediatric readiness measures of compliance. It states plan to address gaps identified through the pediatric readiness assessment gap report. So that's the actual ACS standard. So thanks for sharing that, Bobbin. Emily posted the FAQs, thank you. And Chris is asking if we have a contact who will be an appropriate person to submit from multiple EDs to avoid those technical issues.
Yeah, that's a great question. So certainly the most important thing to remember if you do have someone that has to submit for multiple EDs is when you go on the pedsready.org website and you click through the assessment, you take the assessment, you click on the finish button. Immediately what appears after that is the gap report. So what we want you to do, if you click on finish and you see the gap report, we want you to save or print the gap report and then close completely out of everything. I mean, that's kind of the safest way to do that. Make sure that finish button has been clicked, save and print, and then completely close out. You can even close out of the browser. If you want to, you can use another browser if you want to, but just make sure that everything is closed out before you go back to the pedsready.org homepage and click through and select a new hospital. Now, there is a save and exit feature that people can use anytime during the assessment. They can click on the save and exit button. What that does is they enter in an email address and they send it. It gets sent from the assessment, and they get an email address with a link that takes them back to their survey. This is where we run into a few problems sometimes with people taking multiple assessments, is that, you're in one assessment, you don't finish it, but you try to start a new one, something like that. That's really where the challenges lie. But, if they have a save and exit feature, just make sure that they're completing from start to finish and not going back to one assessment, starting another one, etc. Something else that's a new feature this go around is that when people click on the finish button, they're sent an email with a link that will take them to a separate web page that they can enter in a code, and they can reprint their gap report if they need to. They can hold on to that email forevermore and click on that link, copy the code and paste it into that link, and they can reprint their gap report from there. So it's a super awesome feature. We're really excited about that. That email also contains updates, or not updates, but resources to completion certificates. The EIIC has done, you may have seen them for PPRP assessment, but it's also got a link to the ED checklist and toolkit, I believe. And so lots of great resources on eBill, great follow-up. We thank them so much for participating, and they can reprint their gap report, which is super exciting. We're very, very grateful for that feature this go around. So the gap report will not be emailed. We do the whole link and code thing so that we can protect PII going through email, but they won't have an email, but they will have the link to reprint it if they need to. So great question, Mark.
Awesome. Thank you, Jane.
Mhm.
Sam, a question that's tricky to type out. Yes, please unmute.
Okay, thanks. I tried twice and I realized I was just going to create like confusion to every human and I was failing. So, one of my biggest hurdles is actually, okay, it's a blessing in disguise. I'm really excited. I've been hearing from people, especially since we have the PDF copy to work on offline. They're like, "Oh, can I just submit it now?" And I'm like, "No." Like, you have to wait until March 3rd. And so I think one of the hiccups is some places are just excited, they get going, they get gung ho. When I'm looking at the pedsready.org website, it's not like abundantly obvious that like if they click the let's get started big red button, is there a way to put on it or like a word or a sentence underneath it like this is not the 2026 thing yet or something? Like is there a way to put like a warning on the
Yeah.
pedsready.org website now since it can't be deactivated until March 3rd? Does that
Yeah,
make
that's
sense?
yeah,
Yeah.
that's a great question. So
Okay.
we do have messaging underneath that red Let's Get Started button. It does say the 2026 National Pediatric Readiness Assessment opens March 3rd. Learn more here. That's where they're going to get the copy of the PDF. Unfortunately, we can't run two concurrent open assessments at the same time. So open assessments meaning a national and an open assessment from the same website. So that was kind of our pause there to kind of get people to think about that for just a minute. I can talk on the back end. We've struggled with this because we know people are still taking the open assessment for verification purposes, for improvement purposes, or even taking it to prepare for the 2026 assessment. So I'll definitely see if there's maybe a way we can move that around, but that was kind of our
Can
intermediary
can someone
solution
pull it
there.
up on the screen and show me? Because like I'm not seeing
Yeah,
that
I
statement.
can
Yeah.
share my screen here. Hold on one second.
Jane,
Uh-huh.
also, the open assessment is not open until March 3rd. It actually closes next week.
Yes, that's true. So as of, around about the 18th, the open assessment will be closed in preparation for all of that. So you can see here on the right, Sam, where it says get ready, the 2026 National Pediatric Readiness Assessment opens March 3rd. And then they can click on the link right here.
That's beautiful. Is that
Learn more
live
here.
right now? Because I'm on
Yes.
pedsready.org and mine does not look like that. There's nothing with that warning. That's kind of why I was asking.
Interesting. Can you try another browser and see if that works for me?
I sure can. I've
That's
been
good to
presenting
know.
and using different browsers for like the last 2 weeks to all my core circle to get ahead of this. And like if it looks like that, I mean, thank you.
Yeah,
But
of
yeah, it's
course.
hung
It
up
looks
that way
like
for me.
that on my screen as well.
Okay.
Yeah, mine as well. I'm at Safari, Sam, and I show the same thing that Jane does.
Yeah, you
Yeah,
might
you might
want
need to clear your cookies.
All
yeah,
righty, I will
clear your
do it.
cache.
And
Yeah.
thank you for that. Really appreciate it.
Of course, of course. Yeah. Great question. Rachel, what else is in the chat?
I think we're caught up.
Okay. Sounds great. Can you share your screen again there? I want to see just the slide view. Thanks. Okay, so lots of interesting challenges that you're up against with multiple people wanting to take the assessment. We're so grateful for all of the interest and awareness. I think that's the benefit we've had of doing this assessment over time, is that there is quite a bit of awareness. But again, some of the other challenges are those with turnover and folks that don't, have as much awareness as those that have been doing this for a long time. Yes, please tell all of the PECs to clear their cookies for sure. So let's move forward. Something that we discuss quite often. Cookies. I love that. Something that we discuss quite often is what can we, as the EMSC program, be doing more for you, especially just with the upcoming data collection period coming up. The EDC is keenly interested in things that we can do to help support our managers. I know the EIIC and HRSA are right along with us, and things that we can do to make your lives easier, help promotional efforts, to help support you in meetings, to help, in any way that we possibly can to give you backing, giving you the support that you need. So what can we do to help you? Weekly deliveries of fresh baked cookies. Yes.
Cookies.
Yes. 100%. I would like that.
DoorDash cookies to everybody.
Yes, absolutely. Yes. Girl Scouts, I actually run from Girl Scouts because I cannot say no. That's awesome, Emily. So we are available to you. We are at your service. Yes, you can definitely ask a question on Mike, Nicolina. Please do. Nicolina,
We
are you
can't
there?
hear you talking.
Can you hear me now?
Yes.
Yes.
Oh, awesome. Thank you. So I get a lot of requests from regional trauma advisory councils for anonymized raw data. And I know that's kind of a weird request because the EDC does such a great job of building reports for us. But that's one thing that I think would make life a little bit easier for states that have really engaged committees, is the easier access to the raw data as it is available under HRSA's guidelines.
Yeah, that's a really great question. We love that things are moving in that direction, right? Where folks are wanting to utilize the data. They're moving toward getting more information on a regional level. We know that a lot of states are broken down by regions, either through trauma or for PECs or, for other purposes. So I know that Patty, who's not able to be with us this afternoon, is working on some solutions to that for EMSC program managers during the data collection period. We have discussed this with our EDC advisory committee, and so she might be talking a little bit more about that on the upcoming Tech Talk. So stay tuned for more information, but that's great feedback. That's really
Awesome.
Great feedback.
Great.
We love to hear how your hospitals are using the data. We encourage our respondents, please encourage them to share their scores with their ED leadership. These scores are never meant to be punitive. They're meant to be part of an ongoing quality improvement initiative to help support pediatric readiness as a culture, right? As a culture of pediatric readiness, something that we can sustain within our emergency departments, and we can sustain long-term through turnovers, through changes in the health system. Like, we want this to just be something that it's just what we do. We care for kids and we ensure high quality care for them. So great question. What else can we do to support you?
Yeah, we still have a few minutes left if you guys have any other thoughts or questions. Chris is noting that they have regional trauma committee that would be extremely interested in the raw data to inform a regional QIPI project. Ooh, that's awesome.
Yeah, that sounds really great. Some of these things may need to come in by way of formal research requests. Some of them may need to, have some collaboration between the EDC and the EMSC State Partnership Program Manager to discuss kind of like the breakdown of what they're doing, what they're looking at. But certainly we want to support efforts in as much as we can, but also within, the scope of work that's going on within a very dynamic national data collection period. So we appreciate your patience with this process and trying to support you. So anyone else? Data collection periods are super exciting. I love watching the national map that will be made available. Again, this data collection period, the public dashboard that shows, the percentages of where your response rates are at, in addition to a filter that we have that was similar to PPRP, where you can filter and see the numbers. We know that so many of our states have just hundreds of hospitals, as opposed to other states that don't have quite so many. And so percentages aren't necessarily an indication of effort, which is why we have that filter so that you can see the actual numbers. I can't off the top of my head remember like how many Texas has. I know you have over 300 trauma hospitals alone, but we get upwards to close to 1,000 hospitals in the state, and that's a huge amount of effort. But we appreciate all efforts toward pediatric readiness, whatever the size of EDs in your state. We know you're doing a lot of work to help support them. So, yeah, of course, great, of course. It sounds like I need to start baking a lot.
Baking
Send out
marathon
cookies. Yes.
events.
Cookie of the week. One thing that we did want to share that is coming is that we are setting up a kudo board for our managers from the EDC. For those of you that remember Mike Ely's retirement and Joss's retirement, kudo boards were set up to share, information with them, congratulations, to share, well wishes and pictures and photos and everything. So our kudo board, we hope, will be an exciting space for managers to share kudos to each other, to share successes and wins during the data collection period. Come in, check up on strategies that managers are using, get advice, that kind of thing. It won't be an interactive chat per se, but you can definitely post things there, and we're excited to hear from you. More information will be coming out about that in the next couple of weeks. So, yeah, I think that'll be a really fun thing, hopefully.
Yeah, I'm looking forward to that, Jane. That's a really great idea. Excited to see it implemented.
Yeah.
All right. One more. Okay. Well, if there's nothing else, thank you, everybody. This was amazing participation. I'm so glad we were able to kind of get through our national updates at a relatively speedy pace to allow for all of this really great conversation. And excited that we'll be able to host this again on May 13th. If you do not have it on your calendar, please let us know. Amy, does the next slide have our email? There we go. If you don't have it, please send an email to that state partnerships at emscimprovement.center email. As always, if you have additional questions about the PEDS Ready assessment, please feel free to just reach out directly to your EDCTA or use the PEDS Ready address there. Or if you have communications update or question, need something different that hasn't been provided, there's the email address for that, or just email all three and we'll ensure that it gets to the right person and it gets answered for you. So thank you guys so much. We recognize that there is a lot going on right now, and your dedication and passion for this program and for your states and the PECs and the children in your areas is tremendous. So thank you again for all you do. We couldn't do it without you. We wouldn't be here without you. So thank you. Have a wonderful rest of your week. Happy Hump Day. And we will talk to you. See you soon.
Thanks, everyone.